61. I'm going to do it in the landscape mode. So we did until 60 in the first video. Question 61. Which one of the following statements are typical for classical heat stroke? So the correct answer is A. These are randomly marked answers, so don't pay attention to them. The correct one I will be telling. So it is A. Uh, Older patient and hyponatremia. That is typical for classic heat stroke. Heat can be classical or exertional. Classical is seen in old age, and exertional is seen in um, young age people. So, okay, moving on next. Which one of the following statements are correct regarding Weil's disease? So the correct answer here is B. What does B say? Correct about Weil's disease. Acute kidney injury can lead to oliguria in this disease. That's correct. Microscopic agglutination is the investigation of choice. That is correct. Ceftriaxone given parentally is a effective treatment, but it is caused by not a virus but a spirochete called Leptospira. So the correct answer here would be B. Which of the following are components of SOFA scoring system? So your SOFA scoring system, the correct answer would be A. One is partial oxygen or FiO2 ratio. Then two is your mean arterial pressure. And three is your Glasgow comma scale. Prothrombin time with INR is not a component of your SOFA. What are the components to establish the diagnosis of brain death? So the correct answer here would be B, because first statement, absent brainstem reflexes, that is a criteria. Apnea in presence of elevated PCO2, that is a criteria. It is not hypothermia, but irreversible and unresponsive coma, that is also a criteria. So the correct answer here is B, because B cannot be a criteria. The most common cause of non-traumatic subarachnoid hemorrhage is, the answer is saccular aneurysm rupture. That is the most common cause. Perioperative respiratory failure is an example of type 3. That is perioperative. Um, Type 1 will have less oxygen, type 2 more carbon dioxide, type 3 is your perioperative, and type 4 is due to another causes. So here in type 3 examples can be like due to atelectasis, which is caused after anesthesia. The murmur of mitral regurgitation is best heard at. So let's try to think. It is best heard at cardiac apex. Mitral regurgitation best heard at cardiac apex. What is heard in tricuspid area? It is tricuspid regurgitation. In aortic, you will see aortic stenosis or aortic regurgitation. In cardiac apex, you will see mitral regurgitation. And in pulmonary area, you will see pulmonary wall pathologies. 28-year female presented to the emergency with fever, agitation, and delirium. She was on regular medication of carbimazole, 40 milligram daily, but missed her two doses for the last 2 days. Which one of the following scoring systems would you like to assess the severity of this disease? So, we will do the SOFA scoring here. No, that is the wrong option. We have to do Birch-Wartowski score, option B. Birch-Wartowski score, which is used in thyroid storm. Let's go to the question again. So this is a thyroid storm that they are trying to establish, and the score is Birch-Wartowski's score. Out of the following areas of the brain, which area is most commonly affected on brain imaging in Wilson's disease? So basal ganglia, both your putamen and globus pallidus, both are affected in Wilson's disease. Which of the following are secondary iron overloading conditions? Secondary iron overloading. Correct option is A. So let's see. Transfusion related to iron load. Correct. Thalassemia, you see it. 3. Hepatitis C associated liver disease. You also see that. So all of the above is your answer. You will see secondary iron overload condition. So a new thing here is that your hepatitis C associated liver disease can also cause iron overload. Which of the following are features of Alzheimer's disease? Okay, it's a multiple choice question and we have to select the correct one. The correct option is C. It is a disorder of cerebral cortical function. Only short-term memory is affected. That is a wrong statement. Um, Patients deny that there is anything wrong. So typically, uh, this is correct because they don't have insight. So 3 is correct. 4, depression is a common symptom. That is also correct. So the correct option here is option number C. Lymphatics is the lymphatic-like structure of which system? G lymphatics. The correct answer here is central nervous system. G lymphatics is your central nervous system. Which of the following joints are commonly affected in osteoarthritis? It's a multiple choice question. The answer is number C. So the correct options here are first metacarpophalangeal joint. Yes, the thumb is affected in osteoarthritis. Then the second option, proximal interphalangeal joint, that is also affected. And the fourth option, fifth and sixth cervical vertebrae joint, that is also affected. Not affected is your ankle joint. Which of the following are causes of reversible dementia? The answer is B. So hypothyroidism, vitamin B12 deficiency, and thiamine deficiency. That is your reversible dementia. Lewy body dementia is not reversible. Which of the following are clinical features of frontotemporal dementia? The correct option is A. Uh, there will be personality changes, there will be language disturbances, and memory may be preserved in early stages. This is your frontotemporal dementia. Anticholinesterases are the drug of choice for treatment. That is not the correct option. Which of the following is the myelinating cell of central nervous system? So you have your oligodendrocyte in the CNS, central and swan cell in the PNS. So the answer here will be oligodendrocyte. Which one of the following is the correct description of Mees line seen in chronic arsenic poisoning? Correct options is A. It is a transverse white line on the nails of fingers and toes. So they are white in color. Fomepizole is an antidote to treat which poisoning of the following? So the correct answer here is D, 1 and 4. Methanol and ethylene glycol, you can use here fomepizole. The 4-8 test is a screening tool for detection of delirium. Which of the following parameters are included in the 4-8 test? Correct answer is C, alertness, abbreviated mental test, attention. Apnea is not an A. Apnea is not the A. It is alertness, mental test, and attention. Which of the following combination of lab test results in indicative of heavy alcohol consumption with more than 60% sensitivity and specificity? Answer is D, that your GGT is more than 35, and CDT, that is carbohydrate deficient transferrin, is more than 20. Heavy alcohol consumption, you will see GGT more than 35 and CDT more than 20. What is the antidote of belladonna poisoning? It will be your atropinic, so it will be your anticholinergic. So you give physostigmine because it can cross the blood-brain barrier. So belladonna poisoning, physostigmine. Excuse. Which one of the following prevents GIT absorption of thallium? That will be Prussian blue. Prussian blue is preventing GIT absorption of thallium. A 45-year-old farmer came with accidental consumption of pesticide. He complained of frequent urination and excessive salivation. Which one of the following is associated with this poisoning? This is cholinergic side effects. Sludge. Sludge is salivation, lacrimation, urination, defecation. Sludge is seen in your cholinergic side effects. Consider the following regarding salicylic poisoning. You have to choose the correct option. Answer is option A. 1 and 3 are correct. Arterial pH is low and anion gap is 18. And that is correct. And the other is partial carbon dioxide of 20 mg. So this is a metabolic acidosis. And salicylate poisoning has high anion gap metabolic acidosis. So that's why you have your 1 and 3. Okay. Which one of the following vectors transmit the filaria loa loa? Answer is Chrysops. It's called African eyeworm, loa loa. It can have the calabar swelling, and the vector is Chrysops. Which of the following is the most favorable prognostic parameter in Bell's palsy? It is incomplete paralysis in the first week. That is a favorable prognostic parameter. Incomplete paralysis in the first week. 87. Which one of the following groups of drug is ineffective against gram-positive bacteria? That would be your glycopeptides. Glycopeptides are not effective against gram-positive. So which one is effective? Monobactams, fluoroquinolins, and first generation cephalosporins. Which one of the following statements is correct regarding leprosy? The correct answer is B. That type 2 leprosy reaction is an immune complex mediated syndrome called Arthur's phenomenon. Type 2 leprosy reaction is an immune complex mediated syndrome called Arthur's phenomenon. That is your true statement. Arthur's phenomenon is type 2 type of hypersensitivity. Type 1 is your type 4 type of hypersensitivity. Leon faces appears in tuberculoid leprosy. That is incorrect. Nose is the first site of involvement in lepromatous leprosy, not the last site. A 56-year-old gardener presents with an ulcerative nodule with purulent discharge on his right index finger. He has a prick with a thorn and at the same site around a month back. Which one of the following infection is most likely here? It's your sporotrichosis. A 36-year-old man presents with decreased appetite, mouth soreness, diarrhea, and irritability. On examination, he has a bright red tongue with a pigmented scaly rash around the neck. Which one of the following food item in his diet has a bearing on this disease? So that is corn. This is pellagra, niacin deficiency, 3Ds, that is dermatitis, diarrhea, and dementia. And it happens in corn eaters. Acrodermatitis enteropathica is an autosomal recessive metabolic disorder which affects the absorption of which one of the following micronutrients? Zinc. That's the correct answer. Consider the following statements regarding treatment of vitamin A deficiency. So the correct answer is B, that is 1, 2, and 4. 1, 3, and 4. 1, 2, and 4. Option B. So, repeated high doses of retinol can cause liver damage and teratogenicity. That is correct. Acute overdose of vitamin A may lead to increased intracranial pressure and skin desquamation. That is correct. Regular vitamin A supplementation is also recommended for pregnant women with countries where vitamin A deficiency is endemic. That is incorrect. And excessive intake of carotene may lead to harmless orange pigmentation of the skin. That is correct, and it is called carotenemia. Kocher's phenomenon is seen in which one of the following? The answer is psoriasis. So, Kocher's phenomenon is seen in LPV, lichen planus, psoriasis, and V is for vitiligo. It is Gibner's phenomenon, sorry. Consider the following regarding the human hair growth cycle. And we have to see which statements are correct. The only statement correct here is one. Anagen is a phase of active hair growth. Telogen is when they fall off, and catagen. So, anagen is active, telogen is resting, and catagen is transitional. Anagen is active, transitional, telogen is resting, and catagen is transitional. Consider the following statements regarding oculocutaneous albinism, and then you have to find the correct statements. So the option D is correct, that is 2, 3, and 4. So 1 is incorrect. So let's see. The disease results from genetic abnormalities leading to destruction of melanocyte. So, oculocutaneous syndrome, there is no destruction of melanocyte, but there is only a mutation. So the first one is incorrect. Other three are correct, which is type 1 albinism is due to defect in the tyrosinase gene. Patients may have present with poor vision, rotator nystagmus, and alternating strabismus. Patients are at increased risk of sunburn or developing skin cancer. A 42-year-old um, man presented with recurrent oral ulcers since 1 year, episodes of redness of eye, and genital ulcers as well. Which one of the following is of diagnostic value? It is your pathology test. Because we are suspecting Behçet's disease, and pathology test is done where you will, with a hypodermic needle, you will inject normal saline in the skin and you will see reaction to it. Pediatrics. Which one of the following oral drugs may be used in management of super-refractory status epilepticus? Lamotrigine can be used in super-refractory cases. What can be used? Lamotrigine. Which one of the following are correct regarding the use of benzodiazepine in the initial management of status epilepticus? So the correct statement is B. B is 1 and 4. So up to 2 doses may be used 5 minutes apart if seizures are not controlled. That is correct. And 4 is dose of both lorazepam and midazolam is 0.1 mg per kg. That is also correct. Midazolam and lorazepam both are 0.1 mg per kg. Which of the following statements are correct regarding hypernatremia in children? Option A is correct, 1, 3, and 4. So diabetes insipidus due to deficiency of antidiuretic hormone may cause hypernatremia. That is correct. Which of the following statements are regarding hypernatremia in children? So if there is diabetes insipidus, there is no antidiuretic hormone, and that can cause hypernatremia. That is correct. Addison's disease may be associated with hypernatremia. That is wrong. Addison's use of boiled skimmed milk can lead to hypernatremia. That is correct. Use of lactulose can lead to hypernatremia. Yes, so boiled skimmed milk and lactulose can lead to hypernatremia. Which one of the following statements are correct regarding the management of GIT bleeding in children? Correct answer is D, 2 and 4. Uh, Endoscopic sclerotherapy involves endoscopic injection of N-butyl 2 cyanoacrylate or isobutyl cyanoacrylate. These are tissue glues. That is correct. And fourth one is following an episode of acute variceal bleeding, all patients should receive secondary prophylaxis to prevent bleeding. That is also correct. Endoscopic sclerotherapy has up to 90% efficiency in controlling acute bleeding. So it's actually 90 to 100% efficiency. Stomatostatin or octreotide infusion should be given for at least 7 days after stoppage of initial bleeding to prevent rebleeding. It is given to like for like 24 or 48 hours. Which of the following are advantages of endotracheal intubation in child requiring pediatric advanced life support? You have to select the correct answer. Option B is the correct one. 1, 2, and 4. Correct statements are here. Inspiratory time can be controlled. Positive and expiratory pressure can be provided. PEEP. And the fourth one is reduced risk of aspiration of gastric content. Which of the following are causes of hypocalcemia in a child? Answer is T, 1 and 4. Hypomagnesemia can cause hypercalcemia, and pseudo-hypoparathyroidism can cause hypercalcemia as well. Okay, so we are looking at hypocalcemia, not hyper. Hypocalcemia is reduced calcium. It's there when there is reduced magnesium, and pseudo-hyperparathyroidism. Hypophosphatemia, you'll find increased calcium, and metabolic acidosis, you will also find hypercalcemia because H plus binds to albumin and calcium also binds to albumin. Which of the following are included as a deficiency under Rashtriya Bal Swasthya Karyakram? Vitamin A, anemia, and vitamin D are included, but hypothyroidism is not included. So what is included in deficiencies? Vitamin A, anemia, and vitamin D. Which of the following statements are correct regarding management of hyperkalemia in a child? Option D is correct, 3 and 4. So let's see. Beta adrenergic agonists like salbutamol and terbutaline are used to stabilize myocardial cell membrane. That is correct. Sodium polystyrene sulfonate enhances total body potassium elimination. That is also true. Which of the following is true about rotavirus vaccine? Option C is correct here, 1 and 3. 1 says all vaccines should be stored in 2 to 8 degrees Celsius. And 3 says if there's a past history of intussusception, it is contraindicated. That is also correct. So the vaccine should be used within 2 hours of reconstitution of opening. That is incorrect. It follows the open vial policy. If the baby has ongoing diarrhea, then actually the vaccine can be given if it is not very severe. Then the vaccine should be uh, discarded after 4 hours of opening. A child can make a tower of 3 cubes, runs, copies his mother while sweeping, and has a vocabulary of 8 to 10 words. His developing age is 18 months. You have to add 8 plus 10 is 18 months. Also, mimicry is also happening. So 18 months is the answer here. A child can ride a tricycle. As soon as you hear tricycle, it is 3 years. A teen boy with birth weight of 2.8 kg, preterm, I think they are trying to say, is born to a primary gravida mother through vaginal delivery and cried immediately after birth. Which of the following statements are correct regarding the initial care of the birth? The baby should be initiated on breastfeeding within 1 hour of birth. True. The baby should be kept in a separate area from the mother. False. The baby should be administered zero point 0.5 mg of vitamin K. That's false. It is 1 milligram. The baby should be thoroughly examined for congenital manifestations from head to toe. That's true. So the correct option would be 1 and 4. For a sick child aged 4 years, which of the following are signs of severe pneumonia or very severe pneumonia? Fast breathing, greater than equal to 40 breaths. So this child is 4 years of age, so it should be like more than 50 or more than 40 at least. 60 for 50, 40. Child vomits everything. That is severe thing. Stridor in a calm child. That is an alarming sign. Chest in drawing. That is an alarming sign. So very severe would be your 2, 3, and 4. But here the correct option is 2 and 3. Not chest in drawing. Chest in drawing can also be present in your mild and moderate. In a child aged 3.5 years with an ear problem, which one of the following situation merits urgent referral to the hospital? Tender swelling behind the ear. If you see a swelling behind the ear. Up to 10% cases of autism spectrum disorder may be caused by genetic condition. Which of the following are known to be associated with atrial septal defect? 1 and 2. Tuberous sclerosis and Fragile X. Those are associated with ADS. Which of the following are characteristic feature of cerebral palsy? Answer is B. 1. Disorder of movement. Permanent nature? Yes. Disorder of posture? Yes. Is it progressive? No. Fragile X, tuberous sclerosis, phenylketonuria, Angelman's. These all have ASD in them. Which of the following are the tools for classification of spasticity in a child with cerebral palsy? Answer is D, 1 and 4. You have to use gross motor function classification and modified Ashworth. Gross motor function classification and modified Ashworth. 14. Which of the following medications we use in a child diagnosed with ADHD? 2 and 3. Methylphenidate and atomoxetine that can be used. Which of the following are causes of secondary immunodeficiency in children? It's a multiple choice question. Everything except post varicella state is your secondary immunodeficiency. So, diphenylhydantoin, severe malnutrition, nephrotic syndrome, everything. Which of the following statements are correct regarding vaccination routes for children? Answer 2 and 3 are correct. Two vaccines may be given in the same thigh but separated by 1 inch. That is correct. And separate sites are used when administering a vaccine and an immunoglobulin. That is also correct. A radiopaque density may be noticed in poisoning by which of the following agent? Chloral hydrate. Chloral hydrate can show you a radiopaque density. Chloral hydrate. Which of the following syndromes are caused due to genomic imprinting? Prader-Willi and Angelman. So 2 and 3. As per POSCO, sexual assault is considered aggravated when its answer is C 2 and 3. Abuse child is disabled and is by the staff of an educational institution, like someone trustable, or the child is disabled. The mother of a 14-month old baby developing comes to you, and then what is the appropriate thing as per IMNICI? And she is asking you for feeding advice. Breastfeed as often as the child wants. That's correct. Keep the child in your lap and feed it with your own hands. That's wrong. 3, offer food from the family pot. This is a 14-month child, so we can do that. Give 3 to 4 meals each day. That is true too. So only to keep the child in your lap is wrong. If the child is 12 months, then you can do lap feed up till 12 months, 1 year old. But after 12 months, you have to make them sit next to you. So after 1 year old, they have to sit next to you. So that is paper 1, and we'll do paper 2 in the next video.